So the deal is, if you have a Medicare supplement, a lot of times you think that you really have no additional financial exposure with your Medicare. And I want to start to uncover some myths about that. Today we're going to focus on the coverage gap that is home health care with Medicare, even with a supplement plan. So first, it's important to realize that Medicare doesn't just approve everything, and it's possible that your doctor could be prescribing something or prescribing services more frequently than what Medicare approves. And this is right there in the Medicare New Handbook, so it's important to understand that first reality. Now, when it comes to home health care, if you are receiving home health care from a Medicare approved agency or an agency in your Medicare Advantage plan network that is within Medicare's limits, then you're probably going to pay zero for that home health care. However, if it is recommended at a higher rate or frequency than what Medicare allows, that would be potentially out of your pocket 100%. But the area that really is a gap with Medicare where you're never getting 100% coverage is on home health aid, which is non-medical care at home, right? Help around the house with custodial items like cleaning, eating, dressing, cooking, right? This is home health aid, and Medicare at best is going to cover that intermittently and only when it's tied to skilled care, skilled medical care, like having skilled nursing or physical therapy in the home. If that's not happening, Medicare will not cover home health aid at all. And again, even if it's covering it, it's not covering it fully, which still means a lot potentially out of your pocket. So what can you do about this? Well, home health care policies are a great option to look into. It's something that we always talk to clients about to try to make sure that we are reducing exposure and protecting assets as much as possible. And the nice thing about these policies is that even if you're not using them and you take medications, a lot of them will reimburse you a certain amount every time you fill a prescription for each prescription. So depending on how many medications you're on and your age, state, a lot of factors go into this, but you may find that actually you can get this home health care and home health aid protection without paying much, if anything, in net cost because of the prescription reimbursement. But regardless of that benefit, that is just a nice to have, a nice add-on. These policies are important because, again, you will never have Medicare covering 100% of home health aid costs and not always covering 100% of home health care.